Okay, so this is a really good question because there's a kind of rumor out there that psychotherapy has been disproven, that Freud's ideas have been disproven, shown to be false. And I think that that really is an injustice. I'm very encouraged by recent research and evidence which has shown that psychotherapy and the kind of um, psychoanalytic forms of psychotherapy, the more classical forms of psychotherapy, um, are very effective and are particularly effective with quite severe difficulties, and also that their effects last not just in the present or for a few weeks afterwards, but last for many years into the future. So the current evidence, kind of large scale research which does various trials of kind of the effectiveness of different therapies, has found that psychotherapy and talking psychotherapy has been very, very effective. And there was a popular idea that cognitive behavioral therapy, CBT, was the only effective way of treating things like depression and anxiety, and that's been shown to not be the case. It is often helpful for some people, but other people don't find it so helpful, and other people benefit more from a more psychoanalytic or psychodynamic approach, which is the sort of therapy we practice. Um, so, on that level, there is certainly evidence that psychotherapy is working and it's good, and also people's personal experience ultimately. I've worked with many people, I've experienced psychotherapy myself. I found it to be very helpful. I've seen clients who have found it very helpful, who have really managed to turn things around in their lives. So, I mean, this isn't, anecdotal. This is kind of many years of seeing it in action, seeing it work. So there's that level of kind of evidence. Um, there is another question about how it relates to science. You know, what about, there's a lot of interest in neuroscience and the brain and what's going on in the brain. And, given everything that you know about the brain, isn't it a little bit old fashioned to imagine that two people sitting in a room comfortably having a conversation can change things? Um, and actually, quite the opposite. It turns out that two people sitting in a room having this kind of structured and focused conversation really does affect the brain. It really does affect the pathways in the brain, the habits in the brain, and can effectively be a form of brain surgery, kind of retraining some of the circuits in the brain um, in a way that we don't have any other tools to do. We talk about brain surgery, but brain surgery is really kind of for emergencies where there's blood on the brain or where there's a tumor on the brain. Nobody is using brain surgery in any kind of psychological way. Um, and then we have pharmacological drugs, psychiatric drugs, which again have some effects and certainly do have an impact on the brain, but their effects are quite wide and varied and not always as precise or as human, if you like, as a form of talking therapy. So I think that, when people actually look into things, the evidence and the scientific basis of things is in pretty good grounds. But at the same time, what therapy offers is a very human engagement, a very human encounter. So a person is not made to feel like they're just a bunch of molecules or just a bunch of brain cells, or even just some genes and the product of their environment, but they are engaged with and respected as a singular and unique individual, and that is a part of therapy which appeals to a lot of people.